I'm a big believer in numbers because I feel numbers are very, very important. So we're going to put some numbers up there for the audience to see.
Yeah, that'd be great.
In the year of 2020, Tino, there were 580,000 people, more or less, in the state of Florida that were diagnosed with dementia. Now we're in 2025, and I'd like to ask the audience, how many people do you think it's estimated have dementia in the year of 2025? We'll give you a couple of seconds. Ready? 1, 2, 3. 720,000 people, Tino, are estimated in 2025 to have dementia. Now you're going to say, well, that's interesting. How do we know? Well, another interesting point, Tino, is that 40% of primary care doctors and clinicians say that they feel uncomfortable or lack the tools to actually diagnose dementia. So let's do the math. If you have in 2020 580,000, in 2025 we're saying 720, but 40% of clinicians saying I'm actually not comfortable making a diagnosis, is it really 720,000 or is it a lot more?
A lot more.
It's a lot more.
It totally is.
And another interesting statistic is that from 580 to 720, what percentage increase of dementia has there been? 24.1%, almost 25% increase. That is huge.
You know why?
Why?
People are living longer.
Right.
You know, back in my day, my grandparents were dying off in their 70s. I thought that was old as a kid.
Right.
Now that I'm 55 and approaching this, I'm like, that's not old.
It's not old. My grandma's 92. My other grandma who passed away was 95.
Yeah, yeah. The one who my mother took care of, my grandmother, she passed away at 94. She was the only one that lived that long. But all the rest of my grandparents were in their 70s. And my grandmother was the one that lived that life in dementia. Like I said, they didn't call it Alzheimer's. They called it senility, hardening of the arteries, whatever. But she shared the same behaviors that I see every day. It's not easy. It wasn't easy for her.
It's not easy for her, and it's also not easy for the caregivers. And some of you listening may actually be a caregiver. And this is interesting statistics in the state of Florida, right? This is coming out of Tallahassee.
Yeah.
Tino, 827,000 is the number of caregivers in the state of Florida. And that's unpaid caregivers in 2022, unpaid. And if you're looking at the total hours of unpaid care, that's 1,301,000,000 total hours of unpaid care. And then if you want to convert that to dollars and cents, that's 23,409,000,000 total value of unpaid care. That's on the financial side, Tino. Now let's take a look at the caregivers. Number one, 66% of caregivers themselves have 2 or more chronic conditions.
No doubt.
30% have depression.
No doubt.
Right?
Every day I see it.
And it's honestly, it is very, very huge. I know my family, my mom, my dad, they're caregivers for my grandma. My mom and dad are close to 70. They're 69. Grams is 92.
Yeah.
And think about it, 70-year-old taking care of a 92-year-old. Sleepless nights, right? That could take a toll.
No doubt.
And that's why Medicare came out with a program called the Guide Model.
So let's talk, because I'm so excited, and I'm actually looking forward to keep getting a copy of this podcast so I can blast it out to every caregiver I know.
For sure.
Because they really need any information I can give them on any tool that can help them through this journey. When Guide came out, I was like, this is awesome, right? So I couldn't wait to get together with you. So why don't you tell everybody what this Guide program is all about?
Right. So the Guide program is known as the Guiding and Improved Dementia Experience, right? And it's an 8-year model, right? We start in July of 2025. So we start in a couple of months. And it's a Medicare program. So you're going to say, okay, Dr. Erik, well, it's a Medicare program. Who qualifies, right? So if you or your loved one have straight Medicare, no Medicare Advantage plan.
Talking A and B now.
Yeah, right. A and B,
right.
No Medicare Advantage plan, no hospice, no PACE, you're not in a nursing home, right? And you have straight Medicare, and you have a diagnosis of dementia, you qualify. It's a national program. There's around 280 of us in all of the United States. There's around 30 of us in the state of Florida. Now think about it. 30 of us for 720,000 people who have the diagnosis of dementia, right? And this is a partnership between Medicare and between folks like us, MedBetter Health. Now, you're going to ask me, okay, you tell me who qualifies, but what is GUIDE?
Right.
What can you do for me? Right? Someone watching there is like, all right, this is great, guys. How can you help us at home on the field? So let's talk practical.
Yeah.
The GUIDE has two specific arms. One is respite care. So what does that mean? Now let's use an example. You, Tino, are a caregiver. You have a grandma and you are exhausted.
I've been there.
Right? Yeah. And I'm sure a lot of people listening have been there too, right? You are exhausted. And so now our care navigator is speaking with you and saying, Tino, let's do some tests to see how exhausted you are. You answer some questions and you're like, right? The meter's right there.
Yeah.
So, okay, Tino, how would you like it if you had a home care agency that we, MedBetter Health, would partner with, like Comfort Care, right? And that agency would come to your home and give you respite, meaning 2, 3, 4 hours a week while you're not there, someone to fold the laundry, to do the clothing, to cook something for grandma, just to give you some time to play basketball or relax or spend time with your family. Play golf. Golf is your game, right? You're like, yeah, I'm not playing basketball.
4 hours to get on the golf course so I can get away from that monotony.
And clear your mind a little bit.
It's respite, like you said, that much more. Problem is caregivers, they put this on their own shoulders and it weighs them down and it crushes their spirit and they fall down this wormhole of isolation and depression.
And this is the first time that Medicare comes out with a program that identifies that it's not only the patient, but it's the caregiver that needs assistance. And you mentioned something pretty interesting in that when you're on a plane, what do they say? Before you put on the oxygen mask, right? Put it on yourself first before you put it on your children. And in these cases, sometimes grandma, grandpa, or parents become, because of their cognitive decline, into that cycle. So that's one. So imagine if I were to tell you, Tino, Medicare will cover $2,500 worth a year. And you know what? That's a lot of help for people. That's number one. The other option is adult daycare. What if your grandma's sitting home and she's home the whole time and you're like, man, I just wish for like 8 hours a day, once a week, grandma can go to a daycare center.
Yeah.
That's covered now through Medicare.
Yep.
Or let's say, Tino, you need to fly out to California or New York because you're marrying off your daughter. But you're like, what do I do with grandma? Where do I leave her? Because I have to give her her meds. I take care of her. Medicare now, through GUIDE, through our organization, will partner with assisted living for short-term ALF, assisted living, respite care.
That's fabulous.
Right? It's really incredible. So that's one arm.
Right.
What about the other arm? Right? That's the medical and the care navigation arm. Let's use your grandma again.
Right.
Your grandma is taking 19 meds. 3 of them from a neurologist, 6 from a psychiatrist, and then 10 from a primary care doctor, right? As we all know, not all the time do they all talk to each other.
Nope.
Right? So what does the GUIDE model provide? A GUIDE model provides a care navigator and a dementia proficient clinician who are going to review the meds and be like, 5, 6 of those meds, they're no good. They're actually interacting and they're actually making the dementia worse.
Yeah.
And the care navigator and the dementia profession clinician will call the specialists, will call the primary care doctor and be like, hey guys, you probably don't know, but these meds, can we tweak it a bit? How huge is that for someone like you?
Oh my God.
Who doesn't really know those meds?
It's so true. And you know, sometimes even pharmacists, they know more. If you just bring them all your medications, they're like, you're combining this with this and this. They're actually really good resource for people. Most people don't realize that, but they are. But
it is. It is. So that's the medical aspect. Let's continue. What about if, Tino, your grandma ends up going to the hospital and you are looking at the discharge paperwork and you have no clue what needs to be done now because it's written in Greek for you, right? What if you had a care navigator who looked through those paperwork, called the hospital doctor, Not only that, took that paperwork and sent it to your primary caregiver, care doctor.
Yeah. You have a one-stop shop with somebody, almost like just someone like a care manager, like you said, that can handle all of that for you. It takes the stress off of you. One phone call.
Yes.
Is that what you're asking?
That is yes.
Okay.
How would you feel?
I feel awesome. You kidding me?
That's what the guide model is designed to do. Here's another scenario, right? Because we're so passionate about this. Tino, you're home and you're telling your grandma, Gram, you gotta take a shower. And she's like, I'm not taking a shower. And again, you go, Grandma, it's been a week. You have to take a shower. I'm not taking a shower, I told you. Now, you don't know what to do. Who are you going to turn to? In the guide model, 24/7, you have access to our team. And no one really thinks about, why do you think your grandma doesn't want to take a shower? Now, you have experience because you're
because I'm an educator, but most people don't.
Share it with our audience.
Well, most people, you understand, grandma, number one, when you're losing short-term memory loss, right? She doesn't remember that she didn't take a shower. She thinks she took it that day, right? So most people who have dementia, they're just thinking like, I already took my shower. Why are you bothering me with this? And on top of that, caregivers are so frustrated, they're dictating. And they're saying, they're correcting her, and they're arguing, and they're reasoning, and they're testing her. And then at the end of it, what does grandma say? Out of 10 times you ask her a question, 7 out of 10 times she's going to say no. So there are tricks about learning this language of dementia where I come in that we don't have time on this podcast to do. By the way, if anyone's interested, you could always reach out to me, and I would love to have you one of my support groups to help you with this language.
And these support groups are free of charge.
Free of charge. It's my way of giving back, and I wasn't there for my mom when I was a kid. Matter of fact, I could care less what was going on with grandma. I had enough problems of my own. Right. So I kind of let my mom do what she had to do, but she didn't have support groups back then. No workshops, no conferences that she can go to understand this language. She had nobody. Right. And if I would have known then, Dr. Erik, what I know now, I would have treated my mom differently, and I would have treated my grandmother differently.
Well, now you have a chance to give back.
This is my opportunity.
Through some of the work that you're doing.
Nobody cares how much you know until they know how much you care. And I absolutely care about my family caregivers.
No, it's huge. And, going back to the shower example, one of the things that we've learned, what is the reason people with dementia don't want someone else to give them a shower? I think about myself. I have kids. Now, would I feel comfortable undressing, showing all of my private parts and privacy to my son or daughter?
Absolutely.
No. So there are tricks of the trade, right? How do you make that experience? How do you make it more comfortable experience for your loved one? So imagine if you're a caregiver and you don't know and you need help and you have access to folks like ourselves at Med Better Health. You have access to Comfort Care. And other organizations like the Alzheimer's Association that we have relationships with, that we can help you and navigate you to those resources.
Yeah.
That's priceless.
Yeah, so it is priceless. It is priceless. So now that you're talking to me about this, and it almost sounds too good to be true, I would say, so what's the catch? Is there a catch?
So there really is no catch.
All right, so let's get that question out of the way, because a lot of people are going to ask that question. What's the catch? So we know what qualifies. We got that out of the way. We know what these two different arms are and what they could benefit.
Correct. And it doesn't cost anything, again, to the patient or the caregiver.
Right.
This is as long as you have Medicare, it's free for you.
And they could requalify for it every year, right?
Every year.
And they can use that lump sum. We don't suggest this, but they could use that lump sum all in one, which we don't recommend. We like to see if we can spread this out. Why? Because caregivers, they need that break ongoing, right?
And that's we work with the caregiver and the family to see how much they need. So for example, if it is a lump sum where they have to go away somewhere and it's an emergency and they need to have a 10-night stay at an assisted living and they use that up, that's a possibility. Or it could be where, you know what, I'm so burnt out, Tino. If I can have someone here with me for 3 or 4 hours a week, at least, even if it covers half the year, and then I can cover the other half the year, it's already a huge support to me because I have half the year covered and I only have to cover the other half. Me and my brothers and sisters can contribute to only cover the other half of the year.
That's awesome.
And that's incredible.
It is.